In the past few days, I've had many patients, come to me and ask me how they can potentially reduce their risk of heart attack, heart disease, and stroke. So I wanted to go over that and what I would call my top three. Hello and welcome to the Ask Dr. Pickel show. And today I want to go over what I would call the top three for heart attack, stroke, even heart disease, and how you can potentially reduce your risk. And also the things that I suggest here, you should always check with your doctor. These are based on meta-analysis and studies, meaning where they've taken a bunch of studies and put them together and said, hey, if we look at all these studies at the same time, what do they show and how could these things benefit patients more? So let's dive right in with number one. All right, so this is the Mayo Clinic meta-analysis. And again, like I was stating, with the meta-analysis, we're taking a lot of studies that have been done over time. In fact, they took a total of 40 studies, and this is over 135,267 participants in this study. And what they did is they gave some of them EPA and DHA, which is, in this study, they mainly used fish oil. So with that, what did they find? What did this information tell them? Well, they basically saw that supplementation was associated with reduced risk of MI, which is myocardial infarction. That's a heart attack. So you decrease heart attack risk. There is high certainty that it decreases our coronary heart disease. So again, that's coronary heart disease. That's when the little blood vessels, your coronary arteries, get clogged up. Yeah, this helps with prevention there. And then with cardiovascular disease events, and which again, this can be more like your angina, stroke, heart failure, peripheral artery disease, things like that. So again, all of these issues were improved to a degree with EPA DHEA is what they found. In fact, as we read down here, look at this conclusion. Cardiovascular disease remains the leading cause of death worldwide. Absolutely. Supplementation with EPA and DHA is an effective lifestyle strategy for cardiovascular disease prevention. And the protective effect probably increases with the dosage. So they're saying, hey, yeah, if you take more, you get more protection. And this is based on, over 100,000 people and all these studies. So pretty good stuff. All right, so number one is, again, EPA and DHA. So first of all, the first thing I would like to say is these studies were done with fish oil. And if you'll watch my other video, you'll know that I am not a fan of fish oil at all. And in that video, I talk about the problem with fish oil, which is mercury. And then I'll talk about an option, which is where the fish get their oil, algae oil. So when I look at this, I would say you can get these exact same benefits, if not even better benefits, potentially from algae oil. So this is the way to look. And and we get from this oil, we get these long chain polyunsaturated fatty acids, EPA and DHA. And what do these do for you? Well, number one, they decrease platelet aggregation. And what does that mean? It decreases clotting. So that's very important. Decreases blood pressure, decreases inflammation, decreases oxidative stress, protects the endothelium of the arteries, which is the arterial wall, and then decreases triglycerides. So many effects. In fact, they're probably not all listed here, but many effects from these. And after seeing this and after seeing this study, yeah, everybody should be on this. And again, in the study, they're basically saying, hey, higher doses would be better. So again, and this can vary per person. And this is, again, when we see patients, we don't just use generalities and say, hey, everybody should take this amount. No, we usually will look at tests. We usually find out where you're at, what your condition is, and then we make a recommendation on dosage. So it is a little tougher to know that. So let's go to number two. Okay, so this was the meta-analysis or collection of studies on stroke that was looked at by the Journal of Medicine. And basically, here's what they said. They said, okay, let's look at the effectiveness of folic acid, which that's the synthetic form of folate, in terms of how does it help with stroke risk. So they basically did this whole study through here, and then they said, okay, our results. Our meta-analysis showed that cardiovascular patients who received folic acid therapy had significantly decreased risk of stroke. Wow, pretty good. And again, conclusion. What's the conclusion of all this? This meta-analysis suggested that folic acid supplementation significantly reduced the risk of stroke in patients with cardiovascular disease. How about that? All right, so here was another meta-analysis study where they took a bunch of studies together, and they said, how do B vitamins, just like a B complex vitamin, help with stroke and cardiovascular disease? So again, they're looking at the B vitamins, and what do B vitamins? Well, what do B vitamins do? They affect especially many of them affect and help lower what's called homocysteine. And so they did this study, and again, it was about 4,643 high vascular risk subjects. And then they said, hey, wait a second, B vitamins among these high vascular risk patients who are not taking antiplatelet therapy, they didn't put those people in the study, is related to significant reduction. 29% is big, especially when it comes to the study of drugs or supplements or anything like that in overall stroke risk. So they're saying, hey, you get a 29% decrease just by taking your B complex vitamin regularly. All right, so in number 2, we saw, what is this? B vitamins and folate. And this is a simple, B complex. Well, you want something decent that actually absorbs, that isn't loaded full of junk. But yeah, B vitamins, which, range from your B12 all the way to your B1. And then a big one too is folate, which is one of the B vitamins, but a little more specific in studies with that. The one thing we know is that if you have high, what are called homocysteine levels, this is highly inflammatory for your heart. So you really got to get down inflammation or anything that causes inflammation in your heart. And these B vitamins, especially B12 and folate, have a huge effect on that. And especially if you have genetic issues like an MTHFR genetic SNP or an MTRR genetic SNP. So these could both increase your risk. And that would mean you need more of this stuff. And that's what they found in these studies, that people's levels of B vitamins were way too low. And there's so many things that deplete our B vitamins. So they're crucial, but what do? Decrease your risk of stroke. Who doesn't want that? Decrease heart attack or heart disease risk. Decrease anemia. That means, again, if you're anemic, this doesn't have to be caused by iron. It can be caused by low B vitamins. So now you get less oxygen to your heart and to your body. Increases red blood cell production. That's your blood. That's how you carry oxygen to your cells. And increases energy production, which you need energy for your heart and your body to do its job. All right, so let's go next to number 3. And this was research combined by Science News. So they're basically saying that CoQ10, which is ubiquinol, is the first drug, let me highlight that, first drug to significantly improve heart failure mortality in over a decade. So basically, and they're calling it drug, which it's not, because our body manufactures it. So in summary, coenzyme Q10 decreases all-cause mortality by half. So any heart condition that could lead to death is cut in half by CoQ10. So, and according to these new results, it is the first drug to improve heart failure mortality in over a decade and should be added to the standard treatment according to experts. Wow, and it's just re-emphasized through here, and then it's explained in down lower where they cite all the studies, but fantastic information. All right, so with number 3, this is a really important one and one that I love. It's rarely talked about by doctors, which frustrates the heck out of me in the United States. Let's put it that way. In Japan, this is used as a primary heart medication. Even in the studies, they almost refer to it as a medication, which it is not. This is something that the body manufactures, but can have problems with manufacturing many times, or it can get depleted, especially if you're on cholesterol medication. This gets depleted easily and can actually accelerate all kinds of heart problems. So CoQ10, which the important thing with that is ubiquinol, and watch the other video on that because it'll explain to you more about CoQ10 and the importance of it and how to get it in the right form to take. So you're not just taking the one that's junk and your money going down the drain and your pill going in the toilet. All right, so what does this do? Well, number one, we saw in that research study, pretty much all cause heart issues. You should be on this. Antioxidant decreases oxidation, which decreases inflammation and damage to the heart. Vasodilator, this keeps the arteries wider open so you get better blood flow. Decreases hardening of the arteries, or atherosclerosis. That's where you get the plaques in the arteries. Decreases heart failure and coronary artery disease. Wow. Decreases ischemia and ischemic heart disease. And decreases congestive heart failure. Absolutely. In fact, the list actually is longer than this. That's just what I wrote on there. CoQ10 is amazing. But these three things, in my opinion, are the top dogs when it comes to supplements you should be on if you have increased risk for heart issues, genetic risk for heart issues, or you just want to decrease your overall risk. Again, this is based on these meta-analyses, these studies, and some of my opinions stuck in there too. And like I said, always check with your other doctors before starting any supplements. But hopefully you enjoyed this. Have a wonderful day, and God bless.